What's going on, everybody? Welcome to the Lapeef Network. We got King Talk going on right now. Appreciate you guys for tuning in. Before we get the show started, can you make sure you guys get those likes up? Also, make sure you guys subscribe to the channel. I want to introduce our panel. Let me adjust this mic real quick. Sorry about that. I want to introduce our panel for the night. We got Trill. And then we also have Dr. Brian Walker. Dr. Brian Walker. Let's welcome them to the show. How you gentlemen doing?
Amazing. Doing well, doing well.
Okay, that's excellent. That's excellent. So the reason why I wanted to do this show is because if you guys haven't known already, we have a fellow YouTuber by the name of MTR. He came out, I believe it was Saturday, with a video announcing that he had cancer. And as I listened to that video, one of the major points that he was highlighting was to make sure that we make our health a priority. And so I wanted to kind of make this show dedicated to us, the men, and highlight the importance of our health. So I asked Dr. Brian Walker if he can come on and have a conversation with us. I know you guys have questions out there, and we have some questions ourselves that we would like to at least try to get some answers. May not be solid answers, but at least close to it, and to get an idea of how we should be moving when it comes to this health. So again, welcome, gentlemen. So I want to go ahead. I'm sorry.
Oh no, Jay, I was just going to thank you so much for having me on. I appreciate it so much, and it's good to meet you, and it's good to meet Trill and the audience.
Okay, for the people that just tuning in, can you tell us a little bit about yourself?
Oh, for me,
yes,
JR?
Yeah.
Okay, sorry about that. Well, my name is Brian Walker. I grew up in Chicago on the South Side. Ended up going to college near Chicago, about 40 miles west in Aurora, Illinois. And I actually went to medical school in Des Moines, Iowa, at Des Moines University. And then I did my residency in family medicine at Mayo Clinic in Rochester, Minnesota. And about 15 years ago, I moved down here near Charlotte, North Carolina, just 4 miles over the border into South Carolina, called Indianland, South Carolina. And so I'm married with 2 kids. Men's health is important. And even though we're talking about men's health, let us understand that we're really talking about a family issue, because your health is going to impact your wife, it's going to impact your mother, your daughters, your sisters. And so taking good care of yourselves is going to be paramount to your life expectancy. It's going to be paramount to the betterment of life for you. So we need to keep that in mind, that it's not just about you, it's about everybody around you.
Okay, that's what's up, man. Well, again, welcome. And I appreciate you definitely tuning in for us and taking the time. I kind of want to start off by talking about what's going on right now, which is COVID. I do want to stay away from discussing anything as far as, with what people are getting. We don't want to talk about that, but just COVID in general. Like, what are your thoughts about it? Are you seeing like a lot of men come down with it? Like, how serious is it? How serious should we be taking it?
Well, let me say this, that when COVID first started happening in the United States, a lot of people were making comparisons to the flu. And I can understand why. I mean, we have people that die from the flu every year. We have people that are immunocompromised with certain diseases. older people who have lung problems, heart problems, diabetes, and even very young people who have problems who die of flu every year. And so at first, a lot of health professionals were kind of making that comparison. And then we saw what COVID could do, right? We saw that, wait a minute, we're starting to see healthy people here die from COVID in their 30s, 40s, 50s who don't have any significant health history. That started to scare people. With the Delta variant that we have now, we're starting to see more kids being affected by it. We're starting to see them being hospitalized for it. And we're still seeing deaths on the rise. I can tell you here in the Charlotte area, I work in urgent care. So when patients come in and they're really sick, I have to send them to the hospital. And I cannot tell you how many times I've had to divert going to a certain hospital because that hospital is full.
Right.
People who are being admitted to the hospital have to stay in the emergency room because there are no more beds available. So it is a very serious thing right now. I try to impress upon people to get vaccinated. Just to give you an idea, the health organization that I work for, they will send out graphs every week about how many people are being admitted to the hospital, how many people are on ventilators. And there is no comparison. Those people that are being hospitalized right now, those people that are on ventilators right now fighting for their lives, those are the unvaccinated. Yes, you have a few that are vaccinated being admitted to the hospital, a few that are on ventilators, but by and large, there are people who are unvaccinated. And so we are struggling to try to convince people, get vaccinated, save your life, save the people around you, and just be aware of that we are really struggling right now, staff-wise, in urgent care, in family medicine, internal medicine, in the hospital, in the ICU. We are full. When I start my day at 8 a.m., I go until about 8 p.m., and I can't tell you enough that those people are really having a hard time. And so I want just to make sure that people understand the seriousness of this.
Okay.
Right. Well, I mean, and you said something about like pre-existing medical conditions. I know, especially in the Black community, growing up, for one, a lot of us end up with these pre-existing medical conditions because, for one, we can't afford insurance, and for two,
Right.
a lot of Black folks feel like it's taboo to go to the hospital. I got one of my best friends that died at 42 of heart failure. Right.
Yeah.
And he had went because he was actually working at the refinery and got injured at the refinery. And then he went to the doctor and found out that he had a heart condition.
Okay.
That he had had for years. But even after, when he would have certain pains or certain things like that, and I would be, kicking it with him, I'd be like, bro, why don't you just go to the hospital? I don't need no doctor, man. Them doctors don't know what to tell me, man. So I feel like a lot of that contributes to a lot of those pre-existing injuries that you're talking about. And I kind of want to get your idea on, like, where does that stem from, you think? Why is like getting medical help so taboo in the Black community?
Well, let's talk about what you mentioned before with the friend that's 42. So when we talk about heart problems and the number one condition that Black people suffer from, the number one problem is heart disease. 44% of African American men have some form of heart disease. Risk factors include high blood pressure, can contribute to that, diabetes, increased cholesterol level, obesity, sleep apnea, and cigarette smoking. All of that will contribute to some form of heart disease. And these risk factors are common in African Americans, even at a younger age, just like you mentioned. And the reason why a lot of men don't realize it until it's almost too late is because all of those things that I just mentioned, they cause silent organ damage.
Mm.
And they do their damage for years and people don't know. And so it's important that people recognize that, and so many of us have a poor diet quality, low level of exercise, but we also have some environmental barriers to physical activity. You kind of touched on that a little bit. Some of our neighborhoods lack public and commercial facilities for physical activity. We don't have walkable, safe areas in a lot of our areas to engage physically. That leads us to an increased sedentary lifestyle, a decreased physical activity, which increases the risk for heart disease. And so we have known for years that many of the lower income neighborhoods may have fewer supermarkets, what we call food deserts, may have a lack of specialty food stores, and that just results in a limited availability of fresh and healthy foods. And so when they are present, they're often more expensive compared to foods that are high in fat, high with empty calories, and high with salt content. And so that leads to what? That leads to fluid overload, that leads to congestive heart failure. And so we have to be cognizant of that. And that really takes a multifactorial way of looking at things, not only doctors, nurse practitioners, and nurses, and advanced practitioners, but also our politicians in realizing what I just mentioned and saying, hey, we've got to make a change in our communities to see a change. Right. And you're right. When I talk to patients, especially Black men, what I hear is that, well, I'm healthy. There's no reason for me to go to the doctor. I don't have time. I'm working all the time, or I don't like doctors, or I'll just go when I get a little bit older. I'm not 50, 60 years old yet. I'm all good. And then there's a whole thing about, hey, big boys don't cry. I'm good. I'm tough. I can make it. I don't need, I'm being tough for my family. But the number one thing I hear is that I'm afraid that if I go to the doctor, I'm going to find out something is wrong with me. And what I try to tell people and what I try to tell patients is that, hey, that's exactly what you want to do. You want to go in, and not that you necessarily want them to find something, but you want them to, if they do find something, you want it to be early. If you have heart disease, we can do something with that, early. You have high blood pressure. We can do something with that early. Diabetes, high cholesterol, obesity, we can do something with that. And just using myself as an example, I started medical school at the age of 26, 27, I went to the student health, diagnosed with high blood pressure. I walked around for 3 to 4 months in denial. I said, man, I do not want this. I'm not taking any medication. And finally, one of the brothers who was a doctor over there, one of the attending physicians, he pulled me aside and said, hey, listen, I know how you feel. I know you may not want to start this medicine, but what do you want? Do you want a problem later on? Because you certainly will have one if you don't start this. Now I'm not saying that there's a pill for every ill. That's not what I'm saying. But what I am saying is that I did start the medicine. I did start some lifestyle changes. I was able to make some other changes with my medicine so I didn't have to take so many. And it has made a difference in my life. And so I try to be a testimony to other people in regards to that and say, hey, listen, you can change your life with lifestyle change, and so, but it has to start early. I used to be an emergency room physician for years when I first moved down here to the Carolinas, and I did that for about 12 years. And I can remember one case vividly, Black man in his 20s, mid-20s, blew out his kidneys because he had just high blood pressure for years. And so it's no fun when you have to go on dialysis in your mid-20s, hoping for a transplant and stuff. And so, and I try to tell people, we can control this usually. We can usually do a very good job with it, but we're going to need you to partner with us to do that. And so, it is a challenge, just like you said, Trill, it's a challenge sometimes to speak to people. But I think that when you start to break it down for people and when you start to show them that you want to partner with them and not lecture to them,
right.
When you say, well, hey, man, I want you to help me with this. I can't do it by myself. I need you as the patient to be with me. Then people will usually say, okay, he has my best interest at heart. I'm going to try to listen and try to do well. And I've had really good feedback trying to address it from that manner.
Got you.
All right, I want to ask a couple questions. The first question that I want to ask you right now is it good to get a second opinion? Yes. Double, triple, quadruple, yes. Any health professional, in my opinion, any health professional who does not welcome that is full of pride. And, I have to realize that as a health professional, I don't know it all. And, I like to think that I've learned some things over the years that I can share. But absolutely, you need a second opinion and a third opinion. I think that the more people, fresh eyes that can look at a problem, they can really help. And again, I'll give you another personal example. My mother was diagnosed with stage 4 breast cancer in 2017. And as hard as that was, my mother was brave with it, and she did seek out second opinions. She went to Houston, to MD Anderson. She even went to Duke University Health Systems there in Raleigh, in Durham. So she sought out different things, and they did help her. And believe it or not, it was those second opinions at MD Anderson, those second opinions at Duke that really gave her more life and better life before she passed away. And so, I would tell anybody that no matter who you're talking to, if they tell you something, they very well may be telling you everything may be on the up and up. But I would just say that if you feel something in your gut and you say, you know what, I think I just want to talk to somebody else and just kind of see what they say. And if they say the same thing, then, that's good. But there's nothing wrong with a second opinion. And I think a health professional should welcome that. And even in some cases, offer that to the patient. Okay. I got another question. So I had an experience. I go to the doctor once a year, right?
Yeah.
Early on, it might have been every year and a half, but I had this one experience where I went to the doctor and I just started going down a list of all the issues I had. It might have been 6.
Right.
And that particular doctor was like, whoa, wait, let's handle this right here. And then you come back. Are doctors supposed to address everything in that one session?
That is a very, very good question. I remember when I was in residency and training, and I remember going over that exact same topic with the attending physician. I said, you know what, Dr. So-and-so, this person wants me to, address all of this. And the reality is, JR, that when you're talking about family practice or internal medicine, they are pressed for time. I hate to say that, but they have to get through with you to see somebody else to get through the day. And so depending on what you're there for, if you're for a general medical exam, they usually schedule that out for anywhere from 45 minutes to an hour. In urgent care, I've got about 15 minutes. Now, that doesn't always pan out. I mean, there are some I have patients that come in that need a lot more than 15 minutes. But in general, if you have a long list, what they would usually do is try to get through at least half or 75% of it. And then maybe in the last quarter of it, they'll say, well, hey, this part of it is not emergent. We'll have you come back and then we can address this because we do want to address all of it. But it is true that they may not be able to address every single thing on that one visit. And so that unfortunately is true.
Okay, Doc. You referenced earlier age, and I that rung true to me because I have a 2-year-old daughter, right? And again, how we grew up kind of affects our outlook on medicine. Example is it's like, say if you have a small baby boy and a small baby girl in the same room, if they both fall at the same time, most people in that room are going to run towards the girl. And as the boy, you kind of talk to, oh, get up, man. You okay. You tough. You a man. We ain't supposed to cry. We ain't supposed to feel nothing. So I feel like that kind of contributes to a black man's mindset in terms of going to the doctor. But I bring that context to ask, at what age should we start really like testing and looking for the big stuff? Because I know growing up, like my grandfather was a diabetic. My dad was a partial diabetic. So, but growing up as a kid, you're thinking, okay, diabetes, that's an old man's situation, or heart disease, oh, that's an old man situation. I ain't got to check that. I'm 17, I'm 21, I'm good. You know what I'm saying? So I asked, like, at what age should we start checking for the serious stuff?
Oh, that's a good question. So let's in terms of the big stuff, I take it that you're talking about things like diabetes. You're talking about certain types of cancers and things like that. So, so let's start with colon cancer. I think we all have heard by now what happened with Chadwick Boseman, famous actor, unfortunately passed away from colon cancer. It used to be that the age of 50 was the age where you would get screened for colon cancer.
Right.
And they recently have gone down to 45. But I will tell you, quite frankly, that, when it was 50, even when it was at 50, they always made exceptions for the African-American community, especially African-American men. But it was always a hassle with trying to get the insurance company to pay for it at that age, right? Less than 50 to cover it, as part of a health screening. And so now that it's been lowered to 45, I'll have to go back and double check to see if people are still having those problems. But yes, I mean, you want to get screened. I would say that if you have a brother, or if you have a mother, or if you have anybody in your immediate family with history of colon cancer, you say, okay, what age were they diagnosed with colon cancer? And then you should be screened at least 10 years prior to that. Okay, so if your dad was diagnosed at the age of 55 with colon cancer, you should start your screening at 45. If he was diagnosed at the age of 45 with colon cancer, then you should be screened at the age of 35. And so, people in the health community know that. And so that's why it's always important for you to share everything in your family history, because that's very important. And that's going to let us know, okay, this is not a run-of-the-mill case, that we're going to have to look a little deeper here and kind of take him back a little bit further so that he can get screened. And what I wanted to share with you and the audience as well is that there is a wonderful, wonderful website out there called the United States Prevention Task Force website, United States Prevention Services Task Force. And so what that website is dedicated to is just what you asked, Trill. What age should I start my screenings for this and that? Let's talk about prostate cancer, for example. We know that Black men have a higher risk to develop prostate cancer. In fact, a 50% more risk than everybody else in developing prostate cancer in their lifetime, twice as likely to die from the disease. And so people ask all the time, well, when should I be screened for that? And what I usually tell people, what I usually tell patients is that you should look at your family history, discuss it with your doctor to see when exactly you should be screened. Because, if you look on that website that I just told you about, it'll tell you that, well, it's a very personal decision, that we don't really have any set time for you to do that. And the reason why is because when you look at a test called the PSA, the prostate specific antigen test, that test sometimes can have false positives. And so when you have a false positive test, what does that lead to? Well, it can lead to some unnecessary procedures. It can lead to unnecessary prostate biopsies. And that will, in itself, cause some problems. But I would contend with anyone that for African American men, it's a little different. And I think that I would get a PSA test. I would recommend that because the benefits outweigh the risks with that. When you talk about a 50% likelihood, more so than any other ethnicity, to develop prostate cancer and twice as likely to die from it, then people need to be screened for that. And so, I always tell people, say, hey, listen, if you're 40 and up, you need to talk to your doctor about that. Let them do a digital rectal exam on you. Let them feel the lobes of your prostate. Is it smooth? Is your prostate enlarged? Do you feel any lumps or bumps on the lobes of the prostate? Does the patient have any pain when you do a rectal examination? And so we want to make sure that we are, telling people the right things and doing the right things when people come in, because, everybody has something special about them. And for Black men, that is a special thing. But I encourage everybody to look at that website, the United States Prevention Services Task Force website, and they can just type it in, certain types of cancers, heart disease, whatever it is, they will have, when should I get an ultrasound to check for an abdominal aortic aneurysm? It'll tell you, and so I encourage everybody to do that. And, and going back, and I wanted to roll back to your friend for a minute, in terms of heart disease, I always wanted to figure out a way how I could impress upon Black men the importance of heart disease. And I think I found a way, and that's related to sex life. No, seriously, we know that sex life is a reflection of your overall health. The healthier you are, the better it will be. We know that erectile dysfunction that's caused by heart disease, diabetes, certain medications like blood pressure medications can cause erectile, dysfunction. And so people would ask, well, how is that possible? Because diabetes, we've all had people in our family probably that have had a toe cut off or a foot cut off. Why is that? Because of vascular issues, arterial issues, not getting enough blood flow to those limbs. Diabetes destroys blood vessels. That's why they're more prone to heart attacks when you have diabetes, because of the arteries going to the heart, going to and from the heart, get damaged. And so it makes you more prone to heart attacks. And it messes with the blood flow to the heart attack, messes with blood flow to the brain, stroke, messes with blood flow to your urethra. That allows you to have excuse me, I'm so sorry, it's a live show. So that allows you to have an erection, so heart disease, diabetes, everything goes hand in hand, when you're talking about all of this. And so I just wanted to roll back to that for a minute and just wrap that up. But you're right. You definitely want to be screened at certain ages. High blood pressure, 18 and up. You should definitely get your blood pressure under control. Optimal blood pressure is 120 over 70. Used to be 130 over 80. So, and we'll get to, kind of know your numbers a little bit later, I think. But you definitely want to know that, and so yeah, absolutely.
All right, like I noticed that you said early on that doctors tend to ask about like your family members when it comes to seeing if you would have the same conditions that they may have. I was watching this documentary on Netflix. I forget the name of it, and they said that we don't inherit our family members, illnesses like diseases. They said that it's all in what we eat. So I just want to get your thoughts about it.
Oh, wow. That is a good question. That is a good question. So basically, take hypertension, for example, high blood pressure, right? We know that high blood pressure develops, secondary to a lot of factors, including the genes that you inherit. So obesity again, diabetes again, heart disease again. They all have genetic components that contribute to things like high blood pressure and heart disease, right? And what I like to tell patients is that, yes, I think genetics does play a role, but it is a part of the big picture, right? Because, years back, they did a big famous study called the Framingham Heart Study that revealed that blood pressure has a substantial heritable component, anywhere from 33 to 57%. So that's a chunk, right? That's a big chunk of it. So hereditary issues, they're in play, but most diseases are multifactorial, right? So not any one component will be the sole reason for developing disease. What you eat, how often you exercise, how much you sleep. They're important. How well do you manage stress? So you're right. There are other components besides, when we look at something being hereditary, a hereditary trait, it is a trait. It doesn't mean that you're going to develop that disease. There are other things that you can do about it. Even if you did develop the disease, such as heart disease, high blood pressure, diabetes, it is a lot of what you do in your life, the lifestyle changes that you make and that you have that will determine how you do and what quality of life you will have. And so I think you're right that part of it is definitely not genetic in terms of the environmental factors, but some of it has been proven to be. So I think that as we look forward to these conversations with Black men, we kind of have to start talking about some other ways to eat, for example.
Okay, I wanted you to kind of expand a little bit, get your thoughts about plant-based. Plant-based. Is it better to go plant-based? I'm pretty sure the answer is yes, but I'm just looking. I'm just looking into why. Why plant-based versus the way majority of people eat right now.
Yeah. Well, listen, a plant-based diet, it has been proven to be the best diet out there in terms of maintaining good health. And the reason why is because, you don't have to deal with a lot of the animal protein that has sometimes been linked to certain problems. Red meat, for example, has been linked to certain colon cancers and stuff like that. So you're right. I mean, a plant-based diet is one of the best diets out there. I do realize that not everybody can do that, or not everybody desires to do that. But what I usually try to tell my patients is, my Black male patients that come in, well, every patient, but we're talking about Black men tonight, that what you want to do is maybe cut down. We got 7 days in a week. So maybe you don't have to eat meat 7 days a week. In the United States, we have we think about a certain way of eating, right? We have a meat dish, and then we have what we call sides to go around the meat dish. Everything is around the meat dish. But if we stop and think and say, well, do I really need to eat meat with every meal? Probably not. I can probably maybe eat meat 3 days a week. Maybe I can do it 4 days a week. So maybe we can just go back on. And once you start doing that, I think you'll start to see some changes. And you mentioned documentaries. There is one documentary, and I don't know if it's still on Netflix. If it is, I want people to check it out. If not, please go out and buy it, called Forks Over Knives. Dr. Esselstyn, who is a physician, Dr. Caldwell, who is a trained biochemist, PhD in biochemistry, and did a lot of work in nutrition. They partnered up and they did studies over the years. And in this documentary, they took about 5 or 6 people, put them on a plant-based diet for, I don't know exactly how long it was, but it was a few weeks, maybe a couple of months. And they did not take any medicines. They did a plant-based diet. And at the end of those 2 months, those people were transformed. There was one Black person on there, a Black woman who she worked in a diabetes clinic, and she had history of diabetes herself. And at the end of it, her numbers were so great that she was able to come off of those medicines. Now, am I saying that if you adopt that lifestyle that you're going to be able to come off of your medicine? No, that's not what I'm saying. I am saying, though, that you will probably see better numbers. I remember, being on Facebook years ago and seeing one of my old classmates from Mayo. She did an OB residency, and I was in family medicine. And she posted on Facebook her numbers. She had adopted a vegan diet maybe the year prior. And she posted her numbers, her cholesterol numbers. And I was wondering if she were alive. I said, how can you be alive with those numbers? I said, I've never seen such low numbers before.
Right.
Her lipid panel was great, but it was her vegan diet, and she adopted that. And but I have noticed that patients who have a plant-based diet, they do better with diabetes. They do better with high blood pressure. They do better with heart disease. And there's just no way around that. There's been study after study after study. I think one of the challenging things is just trying to wrap your mind around not eating meat, number one, and number two, trying to find some recipes that work for you. Let's be frank, it can be challenging sometimes.
Very much so.
To do that, not everybody wants to eat a meat substitute all the time, and they're not that great, So you want to, eat some good recipes out there. I know that, different bookstores, YouTube, people have channels on this stuff, and a good nutritionist would be able to help you with that. With some great recipes on there. I will tell you myself that I did it for 6 months last year. Had a vegan lifestyle a diet for 6 months, and I did notice a change and stuff. So yeah. I say it to everybody: if you can do it, if you have a desire to do it, please do it. You will see an improvement with your health.
Gotcha. One thing I wanted to touch on, since we're speaking on Black men, we got to be honest here. Alcohol, drug intake is very big in the community. I have me a drink every now and again as well. Now you have some docs that say, you should just cut all of that out completely. Which we all know, but realistically, people are going to drink, people are going to, smoke, whatever they smoke, do whatever they do. I guess my question is there a safe space as far as intake? Because the older I get, the more paranoid I get every time I pour a drink.
Yeah.
And, some people say, okay, yeah, if you have one drink here and there, you'll be okay. Some people say, no, you should quit drinking completely or you're going to mess your liver up, So I guess I'm asking, is there a safe space as far as intake on whatever your vices are?
Well, I'm glad you asked because, in general, we've always said the medical community, well, if a person takes, 1 to 2 drinks per day, that's not a terribly big deal. But I will say that if a person feels that they are taking too many drinks, then they probably are. They probably should cut back. Yes, I mean, if you drink too much, you can mess up your liver and a lot of other things, and that is true. But I think we kind of the scientists and the medical profession, we kind of send out mixed messages, right? Sometimes
Right.
we say that, oh man, red wine is good for you, in certain amounts, it makes you live longer and stuff. And so different studies have said different things, in regards to that. But but on the other end of that, I mean, I think, red wine is one thing, and Mad Dog 2020 is another. I think so I think that in general, I think that people should watch the alcohol intake. I mean, the calories alone, are higher in alcohol. We know that alcohol is a drug. We know that. So I always tell patients, hey, listen, just watch the alcohol. I remember there was recently I had a 92-year-old gentleman who came in and said, hey doc, I do a cocktail every night. Is that okay? I said, look, you're 92 years old, I mean, I said, you got to 92 for a reason. I said, you can go ahead and do it whatever you want. but seriously, for most people, I tell them, moderate intake is usually okay. It's not, but if, at any time you feel that you're drinking too much, or if you have somebody in your family or a close friend who's saying, yeah, listen, I've been watching you, and I think that you're drinking a little too much. You probably are, and so you probably should look for those cues, because people who care about you are going to tell you that.
Right.
Okay. Hey, Doc, I want to ask you a question. I'm not a fan of taking medication at all.
Okay.
That's usually like the last resort.
Right.
I want to get your personal opinion about this. My idea is that when people put themselves in situations, they go to the doctor. The doctors are in the business to prescribe. And I noticed that earlier you talked about how if you come to us earlier, then we can help you. But in my personal opinion, I'm wondering if doctors are just in the business to prescribe, because I've seen doctors be willing to throw out them high blood pressure pills all the time. I mean, even
right.
Even with myself, I've gone to the
Right.
doctor and they said that it's slightly elevated. And I said, you know what? And I just went plant-based for like 6 months.
Yeah.
And then when I came back, I didn't have an issue. So our doctors in the business to prescribe.
I will tell you that in general, I do not think doctors are in the business to prescribe. I think that on the other side of it, when you come in to see the doctor and the doctor sees that something is wrong, he or she is saying, okay, this person has come to me. I feel like I should be doing something to help. And so maybe I should prescribe this. Maybe I should do this. I don't know if this person is going to come back. Well, for me anyway, because I don't do continuity of care, you want to make sure you're taking care of people. But for those primary care providers, when I put myself in their shoes, I think most of them try to do good work. I mean, that's the reason why we went into this, to do good work. I mean, I'll be honest with you. I mean, it's not the money. I could go into something else and make more money. It really is truly a calling. You're trying to do good for people. And I think that sometimes we can get so caught up in trying to do that sometimes, say, okay, well, maybe he actually prescribes this for diabetes or high blood pressure. And that's why I think that, JR, it's important for the patient to express what you just said. If you came to me and said, hey, doc, listen, I think I know my blood pressure is slightly elevated, but I would like to do a plant-based diet for 6 months, come back and see you. And then we can talk about medication if it's not working. I think most doctors would be okay with that, and say, okay, well, hey, listen, let's try that. And if it's not working, we can talk about some other things later on, or maybe we can talk about some other lifestyle changes that we can make before we start medication. If it's slightly elevated. I don't think most doctors would have a problem with that. But it's a matter of that type of communication that we should have with each other that will lead us down to say, okay, I want to do something for the patient that will benefit the patient, but at the same time, I want the patient to be satisfied with what we're doing, to be okay with the plan, because that's all this really is when you go to the doctor, right? It's a plan, to get you better or to maintain your health. And so now sometimes people come in, and if they've got a severely elevated blood pressure, they say, hey, look, I haven't seen a doctor in 20 years. Then what I'm suspecting is that, the blood pressure that I'm seeing today is probably the blood pressure that you're living with every day. And we need to intervene now, with something so that you don't blow out your kidneys, so that you don't have a heart attack, so that you don't have a stroke. Because at that point, you say, well, do you want to take the one pill a day, or do you want to live with a lifetime of problems that may ensue? And so I do want to say that, just to recap, I don't think there's a pill for every ill by any means, but I do think there is a time to intervene medically, and I'll just be quite frank with you. I don't think that the television commercials do us any good. A lot of times, when it's basically, hey, listen, do you have this? Do you have that? Do you have this? Do you have that? Well, try this. And by the way, there's always a guy at the end who's talking really, really fast, talking about, but it can cause death, stroke, blah, 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 all this stuff, and so I think patients get the idea that sometimes, well, hey, let me just go to the doctor, try to get on this pill, let me try to do this, instead of looking at a lifestyle change. We don't want to prevent heart disease. We just want to treat it. We don't want to prevent heart disease. We just want to do a heart bypass, once we get it, right? We don't want to prevent high blood pressure, diabetes. We just want to treat it when you get it, so I think what most doctors want to do is prevent it. We want to prevent you from having problems in the future. And so that's what it's about. That's why we do what we do,
Gotcha. Look, Doc, we are living in the information era, which means that a lot of us are more privy to medical information than we've ever been in history, in my opinion. I know, especially growing up, it felt like it was a wall there.
Right.
It's like if anything wrong, nobody really know. Everybody has like their family remedies, but it's like for us to get any kind of real information, it's like, okay, we got to go to the doctor. But now with Google and a bunch of information that's out there, people are figuring things out quick. So I guess I want to ask, are you noticing a trend in the right direction as far as Black men taking care of themselves? Or if not, like what are some action steps that we can leave this video and start doing tomorrow?
Yes. Okay. Sadly, no. I mean, I don't think that we are trending in the right direction. If we look at the national death rate for heart disease, for example, the national death rate has decreased for every ethnic group except ours over the years. Every ethnic group has decreased in the national death rate for heart disease every single year except for Black men. The rates for African American men has remained 20% higher compared to the rates of white Americans, the white male American counterpart according to the Centers for Disease Control. So in that respect, no, we're not trending in the right direction, even with all of this information that we have, over the last 10 years and having access to it with the iPhones and iPads and every other electronic device that you can name. We are not moving in the right direction. Study after study has revealed that about 28% of all heart disease deaths among African American men occur in age 65 years or younger, compared to about 13% of our white male counterparts. And so what does that tell me? That tells me that we are 2 times more likely than our white male counterparts to die from heart disease. And that's unacceptable. So, I think that, we have to do better, obviously, with, to JR's point earlier with diet. There's no doubt about it. We have to partner better with our doctors. Trill, to your point earlier, there are, men who are, from an early age, are just drilled into the, hey, look, you got to be tough in this world. Big boys do not cry. Something's wrong. Hey, man, you just go and take care of yourself. Don't go to anybody else. And that's the wrong message to send. We need to make sure that we are telling young Black men, look out for your health. That is the manly thing to do, because you always hear that saying, like, that old Prince song, "I would die for you." Stop saying that and start saying, who do you want to live for? I have 2 kids. I want to live for them. I want to do the best I can with my health. I'm here for them. I want to walk my daughter down the aisle. And so, we have to do a little bit better with what we're doing. But we all have to recognize that there are some things in the medical profession that need to change too. Dr. Olson out of Stanford University, Dr. Graziani out of Berkeley did a community-based study a few years back. They looked at 1,300 Black male participants out of 200 barbershops in the Oakland area. And we're talking about a wide range of income, a wide range of education, a wide range of business. And just about all of them said the same thing. Say, hey, we want African-American doctors to take care of us. We feel that they get us. We feel more comfortable. And in this study, they saw better compliance because of it. They saw better preventable care. Now, does that mean that our white counterparts, our Asian counterparts, our Latinx counterparts don't take care of Black men well? That's not what I'm saying. I'm just simply saying that when I hear people, Black men who come into the office and they say, hey, it's good to see you here. I feel comfortable with you. That does feel good to hear. But at the same time, I want to make sure that I'm doing right by this patient too. Because just because you put a Black patient with a Black doctor doesn't mean it's going to work out.
Right.
If that patient does not feel that you know what you're talking about, if they feel that you're talking down to me, if they feel like you don't want to partner with me because of my health, I don't care what color you are, they're not coming to you. So yeah, they may seek out. And I've had many as an ER doctor and as an urgent care doctor, many Black people when they're leaving out saying, can you refer me to a Black physician, to help me, and I hear and I see that all the time. And like I said, that might get you, might get them through the door, but you're going to have to do right by that patient like you would anybody else. So, we have to kind of take that into consideration too. You know, we need to get more men in to see the doctor. I cannot tell you how many times I've seen Black men brought in by their wives, their girlfriends, their sisters, their aunts. They haven't been to a doctor in years, but because something is terribly wrong now, people they come in. And so, we do want them to come in, but we don't want them to come in at the age of 50 and they haven't seen a doctor since high school.
Right.
That type of thing. So we want them to get in early. But we have other problems that prevent that sometimes. We have cost barriers. We know that men are more likely to be uninsured than women, and that's a problem. So we have to do better as a society, I think, and we have to do better at trying to get men in to see those local health departments that can see them, those state health departments that can see them. And so, yeah, absolutely.
All right, Doc. I definitely appreciate you addressing our questions. I want to kind of bring a few people on. You got a little time to stick around for a second?
Oh, sure.
Okay. All right. I put the link in the description. Just refresh the browsers. I do got it floating around the chat somewhere. Go ahead.
Okay.
No, it's not for. Oh, I don't know. I don't know what he. Here he is. No, that wasn't for you, Doc.
Oh, I'm sorry.
No, that's right. Like I'm talking to the audience.
I'm messing your show up, JR. I'm sorry.
No, you're not messing it up. All right, Mr. The International Millionaire. What's going on? Welcome to the show.
I'm doing pretty good. So I just got 2 questions for the doctor. I appreciate the great information. But my first question is, so most of the time, normally for men, I would say, even myself, I was brought up where my dad didn't really go to the doctor per se, unless it was something critical or major. And the reason being is because I think a lot of men, we are raised to be tough. So tough means that you just push through, even if you hurt, you're down, you have pain, whatever the case may be. And I just think that that's kind of some of the disconnects, at least in the Black culture.
Right.
But my question is for you is, what are some of the questions, let's just say, because men don't normally go to the doctors, more or less the woman, because she normally go for her annual checkups with a gynecologist, things like that. But what are some questions you would recommend that I should ask the doctor to kind of see if we have a common fit or not, or if this doctor may be the best doctor for me?
I got you. You know what? And thank you so much. I appreciate the questions. But some of the questions I think that you should ask are just very basic ones, and just say, hey, listen, what is your philosophy on me partnering with you? Do you think I should have a say in my healthcare? Now some may be taken aback by that, but I think it's you should ask it. I think those who have a true sense of that, I want to do well by this patient. Most people welcome that, So I would ask that. I would ask to say, hey, I was looking on the internet, and I saw this or I saw that, and there's some healthcare providers that hate that say, oh man, I cannot believe you bringing this up, blah blah blah. But I think that you want somebody who's open-minded, and I think you'll get a sense of that when you're talking to them. But I welcome that. I mean, I say, hey, what did you look up? Let's look it up together. Let's see if that pans out. Sometimes it does, sometimes it doesn't. Anybody can put anything on the internet. When my mother was diagnosed with cancer in 2017, even she was looking on the internet, for a lot of different things. And, I would have to sit down with her and say, okay, that part I can understand. That part, I think that's a charlatan. That part I think is true. So I think it's important, especially in this day and age, to Trill's point, a patient can look up anything. And I think that they should bring all of those questions to the doc. They should say, hey, listen, I was looking at this. Do you think this is a possibility for my treatment? Do you think this would help? And if not, why not? And so, no, I absolutely. I mean, I think that you should ask questions that will, determine, whether or not that person is going to be open-minded with you, because a closed-minded healthcare provider, I don't think is going to serve you well. Okay. Everything has to be my way. I went to medical school, you didn't. That type of attitude, that might have worked in the 50s and 60s, and to be honest with you, it didn't work then. But these days, I think that most medical professionals that have come out in the last 20 years have kind of changed attitude. And so, I don't think that you're going to find that same, for most people, you're not going to find that same attitude in the younger docs, probably who are 40 years old and less than you would in some older ones. Now I'm not picking on the older docs, you got some great older docs out there, but just in terms of what your dad went through and everything, I think that it's good just to kind of ask some questions that are going to reveal, well, hey, is this person going to work with me? Or am I working for this person? Because it should be the other way around. I mean, the doctor or the nurse practitioner or the advanced practitioner, they should be working for you. They should say, hey, listen, what do you want to do? Because it's your body. I can't, I kind of like to joke around with patients. Sometimes I say, hey, man, this is not jail. I can't make you do it, but tell me what you would like to do instead. Tell me, talk to me, let's get a game plan going so that when you walk out of here, that we have something that we can look forward to our next visit. And so that's the main thing.
And one last question, and this I don't know, but I'm just going to ask the question as it relates to cancer. Yes. So what would be in your recommendation or your input? Do they know what the origin of cancer is? Because if you look at currently now, for example, my mom is 75, and during her time period, when she was my age, they didn't have this cancer epidemic. So what changed from when she was my age to her current age now, that why cancer is so prevalent in society right now? And I mean, it's all forms. And the only thing that I would say is different is just the manufacturing of food. Mm-hmm. Mm-hmm. So would you say, is there any studies or anywhere someone can go to kind of find out, have there been studies done to prove that food is pretty much the reason why cancer is at an all-time high right now? Well,
excellent question. The short answer to your question is yes and no.
Okay.
Okay. We know that certain things are linked to certain cancers. You mentioned food. So I mentioned earlier that eating a lot of red meat predisposes you to certain types of cancers. One of those being colon cancer, unfortunately. Does that mean eating red meat, you're going to get colon cancer? No. But the challenge is that we can't really predict if who is going to develop that or not. Unfortunately. So yes, in that regard, and then no, in that regard that I think that before the age of ultrasound, before the age of CAT scan, I think we had cancers back then. I don't think that we picked them all up. I think that people kind of died of these diseases and people didn't know exactly what it was. But now that we can scan people, ultrasound people, x-ray people, do all kind of blood tests on people, I think that we're picking up more and more cancers. Okay. By doing that. So kind of yes and no. I mean, I think that there's no, I mean, in terms of studies, I mean, anybody can, kind of look at, American Academy of Family Practice, National Institutes of Health, the CDC, who will list certain studies for you, and everything. But I always tell people too, and it's funny that we're talking about this because I was talking to JR earlier. There was a gentleman in Chicago. His name was Jawanza Kunjufu. And, he always said, if you can't pronounce what's in your food, you don't need to be eating it. So that bag of Doritos you're eating, is a way, I don't really know what's in that.
So that's most of the food, even the seasoning.
Right. Right. So I get that. So we have to be kind of careful, with what we eat anyway, and stuff, just because of the weight gain. And we know that the higher your waistband is, that's directly linked to heart problems. So, you definitely want to look at your BMI, the body mass index, basically your height and weight should be proportional. They'll say, okay, you are this height. This is your range of weight that you should be in. I kind of probably have to lose a few pounds, to get into where I should be, which is why I'm sympathetic to patients when they come in, because I say I know how hard it is to do that. So it's not an easy thing to do. But yeah, thank you so much for your question.
Okay, that's all I have. I appreciate you. Thanks for the
insight. Intentional millionaire. My fault, I messed your name up earlier.
Oh no, it's all good.
Appreciate your question. Thanks for the support.
Well, I tell you what, intentional millionaire, I need to be on your show. I need to be a millionaire. I hear you, but I appreciate you so much.
What's going on? Is it Andrew?
Yes.
Okay, Andrew.
How you doing?
Hey, how you doing? Welcome to the
Hello,
show.
Sir.
Thank you. I just want to say, Doc, I thought you did a great job. Any black man listening to this show tonight should be scared stiff. But not go to the doctor. I mean,
that was not my intention. That was not my intention to scare you.
I know that wasn't your intention, but I haven't had red meat in over 45 years, Doc.
You have not.
Yeah, and I got started with a guy by the name of Dick Gregory.
Dick Gregory, yes, sir.
Yeah, he wrote a book called "Come Back to Cooking with Mother Nature."
Yes, sir. Yes, sir.
A lady by the name of Alvenia Fulton. She had a little storefront office on 63rd Street, right off of Kings Drive in the city of Chicago.
Right.
Him started, and that's how I got started. Because I wanted to do everything that he did. Because in his book, he said that he had all kinds of afflictions. He was developing high blood pressure. He had sinus trouble. He had ulcers, and he changed his diet, and all of that went away.
Yes, sir.
And
yes,
I
sir.
thought that was incredible. And so
yes,
said, I was 16 at the time, and I said, well, you know what? I got to try this. And
How do you feel? How do you feel?
But yeah, so I've been fasting and not eating red meat for 45 years, and so I just want to throw some stats out to you, Doc.
Yes, sir.
My A1C is 5.5.
Okay.
My PSA is 2.3.
Okay.
My overall cholesterol is 161. The LDL is 93. The HDL is 63.
Man,
and
those are great numbers.
Yeah, and I have 20/20 vision. These are my teeth. And my prostate, my kidneys, my liver, my colon, my heart, everything's excellent. And that's not what I say. That's what Northwestern University says, because I only go to a teaching institution.
I hear that. And
I attribute it all to diet, drinking water, getting my proper sleep, and minimizing stress.
Yes, sir.
And I'm kind of like Lapeef there. I don't believe in drugs either. But
you know what?
Go ahead.
Go ahead, please.
Well, I'm coming off of a horrific accident, so I'm really thankful and grateful to be here tonight. to be
Yes,
very
sir.
honest
Wow.
with you. And this was a bicycle. I fell off of a bicycle.
Oh,
Cracked my neck. I mean, it was incredible. I'm thankful to be here and thankful to not be paralyzed. So the doctors actually said that they thought because of the condition that I was in, it helped me a great deal to recover.
yes, sir.
Yeah, but I just wanted to throw that out there, Doctor. I think I appreciate everything that you said, and it's great. And I think this is the dialogue that we should have. And it's, in my opinion, your health is not just wealth, but it is priceless wealth because you can't get it back.
Yes, sir. Yes, sir. An ounce of prevention is worth more than a pound of cure. And just to touch on your point, Mr. Andrew, just to touch on your point, I remember.
I didn't throw this out there too, though, Doc. Not to cut you off, but
no, go ahead.
Those stats that I gave you is for a 63-year-old guy.
If I can be 63 and have numbers like that and look like you, I will be doing well with myself. But because I would tell you, Mr. Andrew, I've never met Big Gregory, but I would tell you that I saw him on a TV program with Tavis Smiley years back. Mm-hmm. And he was talking about he and his wife, and he was saying, look, we don't take a medication, not one medication between us.
Right.
So I think there is something to be said for that. And like I said, the plant-based diet is the best diet that you could possibly have out there. There's no doubt about it. And to JR's point earlier, genetics is only a part of the issue. It's not all of it, and it certainly doesn't have to define you. So no, thank you so much for that. I appreciate that, sir. Yes, sir.
Yeah, are you familiar with the blue zones?
I have heard of it. I'm not very familiar with it.
Okay, so really quickly, the blue zones are areas in the world where people are living past 100 and they're not getting cancer, they're not getting diabetes, they're not getting high blood pressure, they're not getting any of that. And it's all based on the diet that they have. And it's basically plant-based.
Well, you know what? I didn't know it by that name, by the Blue Zone, but I have seen programs on that. Yes, absolutely. The diet, and we all know that if we meet people that work out, and they will tell you to say, hey, listen. People think I'm going into the gym doing all this stuff. And yes, I do work out, but a lot of them will tell you 90% of it is diet, right? And I say the same thing with your health, is that 90% of it is going to be kind of what you eat and drink and put in your body, So I yes, sir, I do appreciate that. And I believe that. Yes, sir.
Okay. But also there is a time and a place for drugs.
Yes. Absolutely. I was
in such pain that they gave me morphine, and I was like, do you have any more? They took me from zero to a drug addict overnight. But I didn't
be careful.
A tremendous amount of pain.
Be careful with that. Be careful with that.
There's a time and a place for it.
There's a time and a place for a lot of stuff, but you're right. We can prevent a lot of stuff. And so I think you're absolutely right on that, Mr. Andrew. Absolutely. Yes, sir.
Hey, Drew, they said in the chat they want you to repeat that book that you said, the book that you mentioned.
Which one? Go ahead.
Dick Gregory's book?
I don't know if that's the one.
Were you talking to me, Lapeef?
Yeah, I'm talking to you.
Yeah, it's called Come.
Oh man, Doc, did you remember the book he mentioned?
I did not. Let me see if I can find it real quick. Hold on for 1 second.
Like come back home to mama's.
Courtney, if you
cooking or something like that.
Right.
Okay, he's back on.
Oh, good.
Let me see you come back in and say it real quick. There you go.
Yeah, I'm back now. I don't know what happened there, but it's called "Come Back to Cooking with Mother Nature."
Gotcha. Okay.
Come back to cooking with Mother Nature, and that's
Mother
by
Nature.
Dick
That's
Gregory.
the book.
And then I have, I would like to talk to you again, Lapeef, because I'm trying to get my own podcast started. Your health is priceless wealth. I'm also on Instagram, so the guys can actually see Doc, I actually got a six-pack to go with that 63 too.
All right, Andrew. Just talk to your daughter and just have her reach out to me, and then
Okay,
I'll make sure that I speak with you. Okay.
Okay.
All right.
Listen. In all honesty, guys, and let me ask you this, Doc. So, can you actually create an environment within your gut microbiome where cancer can really cancer can really exist in your body? Do you think that's doable?
You know what? I think that you can, in your body, I do think that you can do things to help prevent certain things. I don't know if you necessarily can prevent cancer if cancer is going to happen. I know that you can contribute to it. There's no doubt about it, with things like alcohol and smoking and stuff like that. But
I don't mean from a DNA standpoint, because if it's in your DNA, I mean, there's nothing you can do about that.
Right.
But I'm saying if you eat the proper nutrients and you have all the antioxidants and you're taking care of things that will combat the free radicals, and your gut microbiome, the good bacteria, is extremely
I do think you create an environment where you can really help prevent some things, not 100% by any means, but like I said, with certain red meat.
Could you do a 90% probability?
Sir?
Do you think maybe it can be a 90% probability that you will not, come down with any of these horrific diseases?
I'll be honest with you. I don't know if I can necessarily quantify that for you. Okay. But I do think that you doing what you're doing cannot hurt a bit, and I think that you're doing the right things. At the age of 63, I mean, not that a 63-year-old man looks a certain way, but I mean, he looks fantastic, but yeah, I think that you can certainly create environments to help yourself. There's no doubt about that.
Yeah, I think he dropped off again. Appreciate you, Andrew. I got to get around to a couple other people. I don't want to keep the doc on too long. I'm going to filter through these people, Doc, and I'm going to get you off of here.
All right.
Joel, you there? I'm gonna wait till you park. He's a regular person that calls in. I know he's working and listening, so he's gonna park his truck and he's gonna ask his question.
Okay.
Hey, Doc.
Oh, hello, Joel. How are you, sir?
I'm doing good. Hey, JR, how y'all doing?
Hey, how you doing?
Let me first say I appreciate how you bring on professionals, to talk about very crucial topics, because this one is very crucial. I used to be an exercise physiologist. I went to college for that. Of course, I'm in trucking now.
Yes, sir.
My fiance, she works at the hospital and everything. I do have a question for you, but I did want to kind of state the thing about carcinogens, because that's what the brother who asked a while ago, what causes cancer, and I believe those agents are called carcinogens, and it's a lot of different reasons why it is, but pretty much if he wants to look it up, it's called a carcinogen, and a lot of things, it's pretty much anything that damages your DNA that can alter your cells to become cancerous.
Sure.
And of course, so of course the worst ones are malignant. But from what I know, it's been diet and exercise help contribute, but I believe from my personal experience and what I do know in the exercise science field is a balanced diet tends to work best. But the issue with that is you're assuming all the food is natural, which of course today,
sure,
pretty much all the meat is processed. All the meat has some like excessive hormones. Which is why, even though I do partake in meat, I try to keep it as organic as possible, as range-free as possible.
Sure.
But like GMO foods and that kind of thing, those foods are unnatural and they're not proven technically. But I do have a question with you, Doctor. Me and my fiance, especially my fiance, she notices some issues in the medical field. And of course, that's why they have medical insurance. There's always mishaps. Things happen of that nature. But I was made aware that there are still some individuals that are still kind of, how can I say it, ill-informed of certain situations. Like you still have doctors that actually believe Black people have thicker skin, or they
Right.
don't. We don't feel as much pain. And of course, that sister last year,
Right.
who herself was a physician, she ended up passing away because of the maltreatment she received. I don't know if you
I
guys are
saw
aware of that
that.
story.
I saw that.
Yeah.
Yeah.
But so my I know my fiance, she sees, some mishaps happen, at the hospital and everything. But when it relates to the race thing, I don't want to like freak people out, because I do believe the best way to get around that stigma, of course, the older individuals that believe this, eventually, they'll retire and everything. But it's more so like it's the same with the police force. If we were to get more of people, like more Black men into that field per se, right? It would, help correct that issue. And I wanted to ask, like, have you seen, I guess, like throughout your career, have you seen like an increase in Black men and women in the medical field, especially like going after higher end jobs like the physicians and everything of that nature?
Well, good question. Of all the U.S. physicians in the United States, we're really just close to 4% as far as African American physicians. I will tell you that I have seen more Black women in the last 20 years pursuing medicine than men. I will tell you that just from personal experience, unfortunately, I am often the only Black male physician in the department. And I think that's a shame. So no, I have not seen an increase, unfortunately, especially in Black men who are pursuing medicine, whether that be a physician or a nurse practitioner or an advanced practitioner. I have not seen necessarily a big increase in that, especially with Black men.
Well, that's unfortunate, because I do know, I don't want to take up too much time, but I was aware of a story. Dr. T. Hassan Johnson, he has another YouTube channel. He was talking about how there were some instances where brothers going for their PhDs were actually being kicked out of school because of their dissertations and whatnot, because they would do studies on Black male issues. And of course, there's a whole stigma, between Black men and women. And it just so happens a lot of their professionals that they would go to were Black women. So, like, I don't know if that plays a part in it, but I wasn't made aware of that from Dr. T. But thanks for letting me know that.
Well, I know absolutely, and thank you for asking me. And I think that too. To your point, like I said, I have seen that as well over the years, unfortunately, and like I said, I think when you're talking about a PhD program, a little bit different, because you are basically writing a book and you are working pretty much with one mentor. Whereas in medicine, I have a lot of different mentors with different rotations. If I don't get along with somebody, I'm going to be leaving in a few weeks. So I don't just have one person that I've worked with. No, usually, when you get to the PhD level, that type of program, you're working with one main person who's going to be in charge of you getting that PhD. When you have to defend that dissertation, to a team, usually it's that one person that you worked with. And if they don't like your project, a lot of times it will get shot down. And so, now being thrown out of school, that's absolutely terrible. Obviously, but, I'm sure over the years that has happened and stuff. But I don't have firsthand knowledge of that, because I didn't really go through that type of training where I was, kind of doing one project or maybe one or two projects over the years with one person who held my future in his or her hands. There wasn't I mean, it might have been like that for a few weeks, but for me, to go through like a 5 or 6 year program, and to have that, no, I didn't go through that.
All right, Joel, I'm gonna kind of comb through these couple more people. I definitely appreciate the support as always, and make sure you stay safe out there on the job.
So y'all too. Thanks for having me.
All right, thank you again. What's going on, E Black?
What's going on, my guy?
What's going on, my guy?
How you doing, Trill?
What up, bro?
Dr. Walker.
Hello, sir.
How you doing?
Fine, sir.
Oh my goodness. This was such a great thing, in Black health, it's a understatement especially for Black men to kind of have conversations. I remember when I first got my medical plan. I've been a computer programmer for 14 years, and you get your medical plan, you get set. I didn't use it for 2 or 3 years. We don't use it. And
Right.
I think I'm going to make a couple of statements, and then I'm going to ask a question. But the reason why I didn't use it was because, one, for pain management. You sprain an ankle, we had our old remedies. It's rice, raise, ice, conceal, and wrap it up. So it's for the most part we've used these old style treatments as men. Also, it was price. Let's be honest. The deductibles. I remember when I first entered the job market, deductibles were at $150. We're talking now $500, $1,200, $1,500.
Oh, yeah.
These are real life numbers in which if you were to say, "Hey, I had a cough," I'm gonna end up going to a doctor's office, and then I'm gonna pay $700 for a doctor's. Well, first you got to get, because you haven't been in a while, so now you got to pay your initial doctor entry fee, and then not only that, you're gonna have to pay your doctor visit. So now you're in the hole. So for me personally, I can see why a lot of Black men don't do it, because if you're able to get into the position that you are able to see a doctor, you're still behind the A ball.
No, I hear you. And I remember early on, way back when, you entered the workforce and, your medical insurance was paid by the company, right?
Yeah.
And then I remember, they were taking, $30 from each check. And then I remember they were taking, half the premium, And then a few years ago, they came out with these high deductible plans that you could choose from where you didn't have to pay a lot every month. But boy, when you got sick, your deductible was out of this world. And now those plans have become common when you go to work. And so a lot of people have these high deductible plans. I'll give you an example. I work in urgent care, so depending on the patient's plan, they may have anywhere from no copay up to maybe $75 for a copay, sometimes higher than that. But the copay in the emergency room is like, $250, $300. So what does that tell a person? Well, I know I have this really serious thing that I should probably go to the emergency room for, like maybe a heart attack. But I'm going to see what that urgent care can do. Before I go pay that $200, $250 deductible, let me pay the $35 or $50 deductible. And if I have to go, I have to go, but at least I tried, So yes, I mean, I agree with you. That is definitely one of the reasons why it's a challenge to get Black men in to see doctors, like I said, those cost barriers, give us a problem with that sometimes.
Because right now we're at a state where, I mean, even my company, they say, do not go to urgent care because it's costing us too much. It's costing it when you go to these places that have canopies that say ambulance, but all they're going to do if you have chest pain is just ship you off to the regional.
Yeah, I've always said that urgent care is an unfortunate name. Maybe immediate care would be better, maybe walk-in clinic would be better. I mean, we're basically there. I mean, listen, we can take care of some things that your primary doctor cannot take care of. But if it's something life-threatening, you really should be in an emergency room. And the challenging thing is that they'll build some of these buildings so elaborate where they have a lot of different practices in them, including urgent care, that when a person walks in, they feel like they're walking into a hospital. And I've had several older patients, say, well, wait a minute, this is not the ER, so that type of thing. It's like, no, ma'am, this is not, so it's challenging, it is.
So, like I said, and then also, I know this is maybe taboo, but, a lot of times we don't walk in. I want you to kind of speak about STDs.
Okay.
I think we kind of brushed that off because, the black male rate of syphilis, gonorrhea, herpes, a lot of the top tier things that we don't go in to see until it's too late. And then and that kind of segues into my question into regards to having clinics, the accessibility of clinics, HMOs, and PPOs. So I know I kind of jumbled a lot of things, but I think you kind of understand that, as in turn, I want to talk about, how African Americans view healthcare in terms of, we don't do it until it's too late. We don't do it until we get the bumps on us or the cough. And then next thing you know, we're put into a medical system in regards to how the hospital and then personal provider care.
Okay.
And clinics, I'm sorry.
I got you. Well, first of all, let me apologize. I didn't mean to brush off STDs or anything like that. I mean, that's the way. I can't talk about everything, but you're right. I mean, in general, I think that we've always had a problem with STDs. Gonorrhea, chlamydia. Recently, the CDC has recommended going up on shots of Rocephin, which is an antibiotic that is used to fight gonorrhea. Another name for that is ceftriaxone. It used to be where we gave 250 milligrams in the muscle to fight that, and gonorrhea has gotten so resistant now that we've had to go up on the dose. We have to go up to 500 milligrams now just to fight it. And you're right. I mean, there are many people who wait too long to come in, who have, a lot of advanced disease sometimes. And so chlamydia is kind of the sister to that. Both of those diseases a lot of times will occur together.
Just to be clear, gonorrhea and syphilis, which one is curable?
Oh, they're both curable.
Okay.
Yeah, they're both curable. I mean, you can, if you can catch syphilis early on, and first, second, third stage, I mean, it's treated with penicillin. So you can treat syphilis, absolutely. Gonorrhea is a bacterial infection. You can treat that. So both of those are treatable. Now, a lot of the viruses are not treatable. When you're talking about HSV, herpes simplex virus, cold sores on the lip, bumps on the penis. HSV1 is usually on the lip. HSV2 is usually kind of in the genitourinary area. Now that's not curable, but it's treatable with antivirals. And so, if you break out and you have that, we can give you medicines that will help you clear that. But the virus itself will never clear the body completely with herpes simplex virus. HIV, of course, is not curable. I can remember as a kid, and maybe I'm aging myself, but I remember when there was this mysterious disease out there that was killing a lot of people, especially in the gay community. And then when they finally gave it a name, it had spread everywhere, and everybody was affected by that. growing up in the early 80s and mid 80s. And so I do remember that. But now it's at the point where they've done so much research on it and they've developed so many good drugs that it is not necessarily the death sentence that it was 40 years ago. And so they have medicines out now that can get HIV levels down to undetectable levels, and where you are not giving HIV to somebody through sexual contact. I think that's amazing. That probably can't happen with everybody. Not everybody can take those drugs, but it is definitely better than it was a lot of years ago. And so, absolutely, we've made a lot of progress with a lot of these diseases, and but we have not cured a whole lot of them. We got to the point where we can treat them, effectively, but the diseases, the bacterial diseases that were treatable then are treatable now, and basically the viral diseases that were, not curable then are not curable now, but are still treatable.
And I'm sorry. I know
I'm Black. I gotta move on. I know. You don't have to probably see if we get on this calendar. Do off a bit.
Hey, Doc, I appreciate you. I used to spend 2 years or a few years teaching HIV/AIDS awareness, and I it's a touchy subject to me, and I see a lot of brothers not paying attention to that aspect to it. So
no, absolutely.
I really appreciate. I kind of merged the question into another question because I really wanted you to talk about that, but I appreciate you.
No, absolutely, absolutely, yes, sir.
Appreciate the support, Black, as always. All right. All right, so last one, Doc. Last one.
Oh, okay.
What's going on, David? Canadian-born Nigerian.
Hey, how you doing?
All right, make sure you keep it brief. I know the doc got to get off soon.
I know. Dr. Walker, thank you very much for being here. As a Nigerian, we're not familiar with not visiting the hospital or meeting a doctor whatsoever, because I have a cousin who's a medical doctor from Nigeria. I spoke to my uncle about it, and he told me to travel back and forth between Nigeria and the U.S. Now, the question I want to ask is, I know there have not been a lot of Black African-American doctor growth in the hospital, but concerning the foreigner coming into the field within the U.S., what is the dynamic behind that?
The dynamic of
foreign medical practitioner, either be male or female from different countries. I know they're coming in here to kind of like to further their study in the medical field, and it could be based on race, either they're from the African region or they're from other regions. What are the statistical number of people like foreigner coming to the U.S. to study in the medical field? What do you think that number would be like?
Well, I'll be honest with you, Mr. Ayeni. I don't think I know the answer to that question. About how many people, if I'm understanding your question, how many people from Nigeria are coming over to practice medicine?
Yes, I think that a lot. They live in New York City since in the 80s. I've seen a lot of people come out here to practice in the medical field.
Okay.
I've seen that there's been an inflation going on whereby some don't come here to study. They did a study in Nigeria in one of the prominent universities they have there, and they got some kind of mentorship program to come out here.
Oh, I got you.
What I'm wondering, I know it's Chicago may be different from New York, but across the country, you think that there's a fluctuation of high number of people coming in to partake in the field, or it's more or less?
I don't think I know the answer to that. I'm so sorry about that. I'm not familiar with that topic or that number. I mean, I can tell you that I have Nigerian colleagues and who I love working with, and but I don't know exactly how many Nigerians are coming over from Nigeria to study medicine or practice medicine.
It don't have to be from Nigeria, but it'll be from other nations.
Oh, from other nations. I got you. I got you.
Because I understand it's sad that we don't have a lot of Black male pursuing the medical field. You have more of a Black female.
Sure.
I've seen it on other ethnic group, either be Nigerian or from Ghana or for other regions where they're more jumping into that field more than ever. And I'm just wondering what will be the dynamic number of them coming in. That might.
I see. Yeah, I'll be honest with you. I don't think I know the answer to that, unfortunately.
Okay, I got one more question because the one I want to ask, I think will take a long conversation. My thing is concerning the pandemic we're in right now. There's a lot of misinformation going on. As an IT professional, I understand I don't fall for the misinformation, but people believe all type of misinformation of ideology that doesn't make any sense. What do you think about this going on right now? The pandemic is affecting the Black community more than ever, concerning the vaccine, concerning the.
We got to be careful with that.
I know. I'm just saying. You can
No,
keep it
well,
short.
we got to be careful with that word. So I don't want us using that word on YouTube because it's very like trigger sensitive. So
I'm not trying to make it anything. I'm just saying.
I'm not saying. I'm just talking about the word itself. It doesn't matter what we're discussing. When that word comes up, it becomes, I'm not trying to get flagged. So I just rather just stay away from that question, and that's what I was
Okay.
doing in the beginning. It's not nothing in what you're saying, and there's other platforms I had a discussion on, but
No, I'm sorry
YouTube
about
has
that
its
because
rules. Yeah.
the earlier discussion about the medical field, it got me thinking about it for a long time because I've known a lot of doctors in my family.
Yeah.
Maybe 20 or 30 of them growing up as a kid. I remember in New York City, anybody was able to go to the hospital and get a checkup. When I see that, then you mentioned about the healthcare code, which is, I'll be honest, before my big jobs, I stayed without a health insurance for almost maybe 15 years before I met my wife. And I understand the cost to go to the hospital to get a medical checkup is crazy in New York City, but I'm not going to lie. Do you think that there should be a change that will draw back men back into the hospital based on the healthcare code? You think there's has to be the work where all doctors can kind of like speak out about it?
I'm so sorry. I did.
Let me rephrase it. A lot of you doctors know a lot of Black men don't come to the hospital due to the medical costs. Do you think they have the political power to change that narrative whereby they can help convince politicians to bring down the cost? Because as long that people don't go to the hospital to get that checkup, you're not gonna have a lot of healthy workers coming to work. Let's be honest.
Okay. And so you're asking me if I think that Black men have enough political power?
Black medical doctors, like, I think they, you know what?
No.
I'm trying to get the question indirect because I got so much in my head. I'm trying to condense it, not to make it too broad.
Sure.
What you said was very, very logical. It doesn't make sense because due to Black men, they don't go to the hospital because one, the health insurance is too high, the deductible is crazy high. You can't pay it.
Sure.
One like me, before I got married, they without insurance for 15 years, and luckily nothing dangerous happened, which is kind of scary. I'm not gonna tell anyone to try that, but as a father and a grandfather, do you think that this is a issue that it should be being brought up more in the Black community more than ever concerning proper checkup, proper medical diagnosis can be taken care of instead of going to the ER too much? Because in New York City right now, the ER is flooded.
Right. The ER is flooded.
No one go to the doctor for a regular checkup. They just like go straight to the ER, and that's about it.
Right, and that's unfortunate because when you go to the emergency room, they may charge you an initial fee, but but they will end up billing you a lot more money for that ER visit than if you were to go to a doctor's office, and especially if it's a simple issue. And so when I worked in the emergency room, we saw a lot of that. People would come to the emergency rooms for, a simple cough that had been going on for a couple of days, or, I cut my finger and it's a little bitty cut, or something that can be handled in a doctor's office. And so you're right. I mean, it's flooded, and I think if I understand your question correctly, it's asking, does the Black medical profession have enough political power to change this, right? So, in terms of the National Medical Association, which is a Black organization, and other organizations that we have, a lot of that will have to kind of come from the patients, I think, to kind of say, hey, it's going to have to come from everybody. It's going to have to come from us as a medical profession. It's going to have to come from patients. It's going to have to come from politicians. And we're starting to see that a little bit. Over the years in Congress, different things have past to kind of help us a little bit, but there's a long way to go, Mr. Ayani. You're right. Especially during this time of COVID, we're still, the places are full. We're full. When I start my day at 8 o'clock, by 8:18 in the morning, I've got a 10-hour wait.
Makes sense.
And
One
so
question.
it's.
I got one question. It's only a yes or no answer.
Uh-huh.
Do you see this country having its own black-owned hospital anytime coming soon?
Black-owned hospital. Well, you know what? I mean, I think that, years back, we used to have them. We used to have them in Chicago. But that was a time of segregation too, and so I don't know if you're necessarily going to see a black-owned hospital now, with the way that America is now, with integration and such. I don't know if you would necessarily see a black. Are you talking about a hospital for black people? Or are you talking about a black-owned hospital?
The reason I'm saying that because we have heard about medical malpractice toward to the black patients, especially to the black mothers as well. I've seen that interview they had last year with William Martin, whereby the one medical doctor who had COVID had a malpractice taking place upon her when she told the other doctor what the symptoms she had, and they avoid or ignore her whatsoever because she's a black patient.
Mm-hmm.
I'm wondering, do you think it will be possible that in this country, I'll say years from now, but we think probably we would have our own hospital and treat our own black patient different from the regular hospital that people are going in, they're waiting for so long for a regular checkup, but they'll be bypassed because they'll either be trained or be taught to ignore the black patient. They're like last on the list whatsoever. You think that would be possible?
Well, you know what, Mr. Ayani, I think we need to work on the hospitals that we already have, and I think that we need to improve the treatment of all people in the hospitals that we have. I don't know if the answer is necessarily to have a black-owned, not black-owned, but a hospital for black people. I don't know how you would get. I don't know how you would do that.
I know, but in this city, the Jewish people have their own.
Okay.
Ironically, in New York City. So when I scratch my head and I see such thing, I'm like, how come we don't have our own? Yeah. Maybe in New York, you see things that you never thought it really existed. I saw a black-owned hospital, a black-owned Jewish school, and they have their own bank and etc. And I wonder why they get treated better than we are getting treated. If you get to the hospital, it's an emergency. They ignore you. Wait there for maybe 10, 20 moments to an hour before they answer you. I'm asking that because if other ethnic groups in this country, especially in this city, have their own, what wrong we have in our own that we can treat our own people better?
Now, are you saying that the Jewish hospital, they only admit Jewish patients, that they would never admit a black patient or anything like that?
They admit other patients, but I know that they treat their own people quicker than they treat everybody else. It's like a level of favoritism.
I don't know. I can't answer the question.
I don't think that's helping us move forward.
Yeah, I've never been to New York, but I don't know if that would necessarily solve the issue.
I'm just asking from your own expert opinion. I'm just asking that because people talk about it for years, and I kind of like listen to the debate, and I'm kind of wondering if it's needed or not needed.
Yeah. Well, I think I would improve the hospitals that we have.
Let's find out, doctor, and then we're gonna get them off, David.
It's done. I had enough questions. I know how my brain works. I want to ask you a question because being around medical doctor for years growing up, I always have so much questions to ask from a doctor, and it's a habit.
Sure.
So when I see one, I'm going to sit down and try to digest all the information I can get from a doctor. It's a habit from Nigerian. We do that a lot at Nigerian.
Of course. Yes, sir.
So all right. See you. I really appreciate it.
All right. Thanks for the support again, David. Appreciate you.
No problem.
All right. That's all the calls, Doctor. We definitely appreciate you for coming on the platform tonight.
Thank you all for having me. I appreciate it so much. And it was just such a great discussion. So I hope we talked about some issues that you guys found informative.
Oh yeah.
Definitely, you got me about ready to change my whole diet, Doc. I never really considered the plant situation, but I'm looking into it. As far as the alcohol, I can't promise you that, Doc. But the plant,
I hear you.
plant based, yeah.
I hear you. We'll do it together.
Trail, my man. Thank you, man, as always, brother.
Yes, sir.
When I'm being in Houston soon, man. I want to thank you for coming out. And you people out there, if you guys find value in this, make sure you guys share this and hit the like button right now. Thank you for tuning in to King Talk. And again, gentlemen, thank you for blessing the platform with your grace. And until next time, we are out. Nope. 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 Bruh. 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 Bruh.
Bruh. Ain't nobody got time for that. Bruh. 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 Ain't nobody got time for that. Ain't nobody got time for that. Bruh. Ain't nobody got time for that. Bruh. Bruh. Ain't nobody got time for that. Ain't nobody got time for that. Bruh. Ain't nobody got time for that. Ain't nobody got time for that. Bruh.
Nope. I'm just having some fun, man. Definitely appreciate you guys for tuning in to King Talk, man. I'm trying to elevate, man. I'm trying to bring something to this platform that you guys don't normally see. And we're gonna steady keep growing. This is the greatest network ever. Lapeef Let's Talk is the greatest show ever. We got some surprises for you guys. Courtney Michelle is going live tomorrow, 8 p.m. Central Time. Courtney Michelle is going live, and then you know we got the greatest show ever, which is Lapeef Let's Talk on Thursday, 7:30 Central Time. Make sure you guys hit that like button right now. Also subscribe to the channel. It really helps when you guys hit that like button, because guess what? Everybody get a chance to witness greatness. So make sure you guys like and continue to share. Play a couple more tracks, and then we're gonna get up out of here.
Yeah.
Last song, y'all. Definitely appreciate you guys for the constant support. Thank you for all the super chats, all the cash apps, PayPals, all of just the likes you guys do, the support, the shares, the Facebook group, Instagram. Appreciate the love, you guys. Thank you. up, McCain? Entertainment Network. Appreciate you, Lucky. Shout out to you too. Shout out to you, Jonathan. Appreciate the super chat. Thank you, Perry. Appreciate you. Service USA, LLC. Appreciate you too. Remember, Courtney and Michelle going live tomorrow, 8 p.m. Central Time. Also, Lapeef Let's Talk Greatest Show Ever. That's going to be on Thursday at 7:30 Central. I'm out of here, y'all. Y'all be blessed. Make sure y'all stay out of trouble. And health. Women and men, make sure you guys make the health a priority. That was basically the point, the highlight of the night, is making our health a priority. And I'm definitely going to probably go back to plant-based, especially after seeing Andrew on there speaking about everything that's been going good for him for 63. It ain't guaranteed, but if I had a choice to be on the positive side, I want to be on the positive side as much as possible.